Kidney cancer is caused by cancerous cells that arise from the lining of tubules within the kidney. Another name for this type of cancer is renal cell carcinoma. There are 5 main types of renal cell carcinoma or kidney cancer. The most common by far is clear cell carcinoma, followed by papillary, and then chromophobe. There are a few others, but we encounter these quite rarely. Kidney cancer is more common in men than women and is diagnosed at the average age of 50 to 70, but can occur at any age. It more commonly affects people that have a history of smoking, obesity, or high blood pressure. There also are some genetic diseases that put patients at a higher risk for developing certain types of kidney cancer. Another group that may be affected is patients with chronic renal failure who are on hemodialysis. These patients may develop acquired cystic renal disease, which puts them at a slightly higher risk for developing these types of cancer. Traditionally, patients who presented with a diagnosis of kidney cancer would have an abdominal or flank mass or pain in that area, blood in their urine, or high blood pressure. They also may have systemic symptoms such as fevers, night sweats, weight loss, or even a low hematocrit or anemia. Fortunately today, we catch kidney tumors at a much earlier stage. Most patients have no symptoms at all. Nowadays, most kidney tumors are diagnosed as an incidental finding. What I mean by this is a patient has back pain, goes to their doctor, an MRI is ordered. The MRI is done to work up the back pain, but what they find is a small tumor on the kidney. This allows us to diagnose kidney cancers at earlier stages and treat them in the beginning. We also will order some blood work. This will include labs to look at your kidney function and also your liver function. A chest x-ray will also be ordered to make sure there's no evidence of spread of the kidney cancer to the lungs. Surgery remains the mainstay of treatment for kidney cancers. When a tumor is small enough and in an accessible position in the kidney, we often will remove only the tumor and the surrounding tissue. This is called a partial nephrectomy. This can be done with an open procedure, laparoscopically, or even a robotic-assisted laparoscopic approach. The reason that we do this is because we want to maintain as much good functioning kidney tissue as possible. For larger tumors or tumors that are difficult to access, we often will have to remove the entire kidney. But this can be done through minimally invasive approaches, such as laparoscopy. For patients that are not good surgical candidates and have a tumor that is 3 centimeters or smaller, observation of this tumor is an option. We also employ locally ablative techniques, such as radiofrequency ablation or cryoablation, to help with local control of the tumor. Chemotherapy is used for renal cell carcinoma, but only in patients that have very advanced or metastatic disease. The survival rate for kidney cancer is dependent on several factors. This includes tumor grade, tumor stage, meaning is it confined within the kidney, and also is very dependent on the patient's overall health status and their age.